record. All right, so good morning, welcome back. I wanted to, do you see the student view? Right, somebody needs to mute, please. So there was an announcement that went out. Isaac had questions about the clarifications for the assignments. So I wanted to show you that, review that. So there is a group activity for week 4. That's the one, remember, that was supposed to do before the exam, but I had said that no, you didn't have to worry about that because you had the exam coming up. So what was decided is that yes, you do need to do it, but it's due tonight. Like, it was extended a week. And you can do it, you only have to answer one of the questions. You don't have to answer all of them. You can do it individually or in a group. If you do it in a group, just put everybody's name on the paper, and then we'll know to divvy out the points for that. But there was a question if you guys were still able to do that, and yes, you are, until midnight tonight. And then for the lab assignment, remember I said I was going to put up a reflection, and what this is going to count for is for your lab hours, right? Because were we not in pandemic mode, you would hopefully be making, having relationships with your patients and being able to home visits, schedule home visits. And so for like week 3 and 4, that's, 2.5 hours that you would participate in a home visit or a telehealth visit and do the cultural assessment. And then the same thing for the family assessment. So in order to sort of get you guys ready to do that and really jump in and do that, what we would like you to do is sort of prepare. And that's what this assignment is for. And it's not really points because it wasn't in the syllabus, but it is preparing you, and the time that it takes you to prepare the assignment goes towards your 47 lab hours. Right. So, and some students had messaged me yesterday and were kind of confused. And so I'm hoping to sort of, I'm sorry, I'm dog sitting. Yeah, sure, no. And we're a little confused on what exactly was meant. And so basically, you need to do the cultural assessment and you need to do the family assessment. And it needs to be either, you can do it at telehealth, it could be at like a flu clinic or the food bank or something. You could ask, people that are in line, you could talk to them. You could establish a relationship with a patient from the clinic or the hospital and, Zoom them or FaceTime them. You could, which is not the best choice, but you could also conduct the assessments with a client in the hospital or in the clinic, at the point in time when you're actually there. And so how are you going to incorporate the cultural and family assessments into your visit? So in other words, if you're going to do, a phone call, you're not just going to say, oh, hi, this is Shani, and start asking questions, right? You're going to sort of set it up and get some other information first, perhaps. And if you're actually doing it in the hospital, that's a little different. If it's at a community event, then maybe you're going to, kind of people in the room or people in the food line and sort of determine somebody that's English speaking or Spanish speaking, or, and that's how you're going to figure out how to incorporate your assessments into those visits. And then what is your timeline? Like, that needs to happen hopefully, within a couple weeks. And if you review that information, it talks about how to do the home visits and the first knock, which you're not actually going into someone's home, but like how to make that first contact. And then these are examples of the cultural assessments you could do. Here's an example to the family assessment. Those are the ones that you would be completing as part of that. So does that make a little more sense now?
Yes, but I have a question.
Yes, please, questions, go for it.
So these are hypothetical visits, or will we actually have to do a Zoom or FaceTime with somebody? Okay, good.
Yeah, that's up to you. That's why there's several different options given to you. And there may be options that we haven't even thought of. So if there's something else you can think of, that's fine. But the point is to actually interact, right? Like if it was non-COVID, you know, you'd meet your patient in the hospital and you say, can I, you know, they're getting ready to be discharged. You say, hey, can I come visit you at home? I would love to, you know, assess your home for safety and talk to you about your family. And then you'd set up a time to go do a home visit. But we can't do that. So it could be that you set up a phone call or a Skype or a Zoom or a, you know, whatever works to do it. But these need to be actual, some type of quote unquote home visit, telehealth, something like that. And so, yeah, and so we were thinking that this might help you prepare a little bit better, like to actually be able to, because again, it's only week 6. You've really only been in the hospital a couple weeks, like 3 days, 4 days, 3 days, 3 days, you know, so it's a little more difficult to develop those relationships, right, with the patient. If unless, you know, if you were there 2 days during the week with them, it might be a little bit easier. So does that make sense? And that's due next week. And then what was the other one? Oh yeah. And then the other one, so this was all in the announcement. I just added them all to the module as well, so you can access them from there. So then you had from week 5, we talked about patient education, right? And so you were supposed to be working on either a video or flyer, something about a health topic. So I just put it into sort of a scenario, right? So like KSBW has this health hour program. They want us to provide videos and you know, flyers or things like that. You could do a script for a radio ad, and then you need to determine your target population, choose your topic, select evidence-based strategies. Like if your target audience is children, how are you going to teach a child versus how are you going to teach an elderly person versus an adult? You need to include at least 3 key teaching points in your video and or flyer radio script, and then at least 1 credible source, which should be an APA format. You can do it in groups if you would like, that's okay. So you can do it individually or in groups, but no more really than 4 students or it gets kind of messy, I think. And then have 1 person submit and add everybody's name to it. And remember to, you want to provide rationales like either in the comments or in a separate documentation, like why you chose the topic, why you chose that particular target population and the teaching strategy that you chose. Does that make sense? And that's not due next week, that's due the 16th. And this one's usually kind of fun. Students, we've done various takes on this assignment in past years, past semesters, and it's usually pretty fun. So questions on any of those assignments? Did that answer your questions, Isaac?
Yes, it did. Thank you.
Oh, you're welcome. Reload. Okay. So let me do this now. I'm going to share screen again. Okay. So this is so week 5, right? I added those in there so that you have those available to you. Okay, so week 6 for lab, there's no lab, right? Because you're working on that other stuff that you're working on for your home visits. There we go. All right, and so then we're going to focus on development today. There's a lot of information, but the thing that we're looking at is not so much right now what are the specific developmental milestones for children, but to sort of just have an overall understanding that there are different screening tools, different ways to identify if there's a delay, and what kind of risk factors there are for delay, and what we can do to identify and then get, I don't want to say treatment, but collaborative interventions for that. So the assigned reading was, let me check out the chat here. Sorry, gotta have. So the home, so that's a good question, Armel. Armel's asking, is the home visit individual or in group?
I was gonna try to throw everything away afterwards.
So make sure we mute. Thank you. So it's supposed to be individuals. I guess I'd have to talk with Ms. Clark, but I could see if I could see going in pairs, because if you were actually doing a home visit, it would probably be better to go in pairs if the client was, if that was okay with the client. So, but you would have to do, an individual write-up. So like, for example, Armel, if you went with Isaac, right? Like the both of you would go to visit your client, and then the both of you would go to visit Isaac's client. Like you could do it that way. I suppose you could do it, I don't know. Let me talk to Ms. Clark. Let me get back to you on that one. I'm not opposed to pairs, but I don't really want to do more than pairs for the home visit. Is that something students would be interested in, would be doing it in pairs?
Yes.
Yes.
Yes, 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 yes. Okay. All right, let me make myself a note here. Pairs. Okay, and then we can redesign the assignment, right? So you know what you need to do if it's in pairs. Does that sound okay? Yeah. Okay. So really all you needed to do, and again, I'm sorry, I thought this was published. It wasn't. You guys have to remind us, me especially, because that's always my weak point, is remembering to publish the module. So chapter 1 in development, if you wanted to read in your ATI care of children, it would help if I said that was care of children, wouldn't it? These are the milestones for each age group, right? So if you wanted to brush up on that, you could do that. In ATI, there's a growth and development template we'll talk a little bit about. And then I thought this particular website was, PDF was helpful because it's a little small. Sorry, I can make it big. Sorry, I'm gonna get the dogs out of here in a second. Where did it go? Make it bigger. There we go. Can you see that better now? Right, it has developmental milestones, gross motor, fine motor, right? So I think this one is a really nice, nice summary, okay? And then, did you see that? You saw that, right? Somebody tell me you can see the PDF with the milestones. Yes?
Yes.
Yes, thank you, okay. Hold on, let me kick the dogs out. Hey, come on, out. You just wait till Daddy gets home. Come on, Doge. Vinny, go. 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 Thank you. Sorry about that. So I think that's a good resource because it has everything on the same page, like on one page for you, which I think is good. We're gonna actually look at a couple of these sites today. And then the developmental theories, again, you don't necessarily have to know everything about the theories. It's there for you to look at. Just know that there are theories for children, there are theories for adults, and the ones that I would concentrate on would be Erikson and Piaget. Like if there's any theories that you really need to know as a nurse, those are the ones that are really going to come in handy for child development. And then there's also some, the adult screening guidelines, I think are good. So like when do you get breast exams, mammographies? And a lot of you are seeing this at Clinica with the pap smears, right? And the breast exams, these are things that you guys are actually witnessing. You know, so it gives you a time frame for that. Again, supplemental, you're not gonna be asked about that necessarily. There's also for geriatric assessment tools. This is what I use when I teach geriatrics. There's a Consult Geri. You can actually go into this general assessment series. And I'm looking for so there's, let's see, that's orthostatic hypotension. Which ones am I looking for? So here's one, for example, assessing nutrition in older adults. What tool do you think that they use to assess nutrition? I think you guys talked about it in nutrition.
You talking about like the food journals?
A food journal would be one. Oh, it didn't pop up for me. Hold on. Why did it not do that?
There was that mini assessment nutritional form for
Yes,
older
there
adults.
was. Yes, there was. And I don't know why it's not opening for me right now. It opened last night. But yes, the mini nutritional assessment is what it will, oh, there we go, is what it will pull up for you. So the nice thing about Consult Geri is it gives you sort of a little description. It tells you the best tool, talks about, oh, look, validity and reliability, right? We talked about that in evidence-based practice, right? And then if there's strengths, limitations, and then it actually, for this particular one, if you get through all this, there's actually a video of how to use the tool, and then you can even download the tool. So if you go there and download it, there it is. It tells you how to do it, gives you the same rundown, and then there is your tool, your mini nutritional assessment. So this is a place to be able to find different assessment tools for the elderly. And then let's go ahead and, excuse me. Oh, okay, so the assignment. So this is one that is due at the end of, by the end of the semester. I think the students that have been at Clínica de Salud so far have gotten to see well child visits, the CHDP visits. And so I'm gonna put a little, this has always been in the syllabus. I'll put a little reflection up for you to do, but you only need to do it after you've done the well child visit at Clínica de Salud. So that's why it's not due till the end of the semester. And I'll post that by Monday. So some of those things are due at the end of the semester because it depends on when you're at Clínica or when you're in the hospital.
So we absolutely need to make sure that we get to see a well child visit done.
Yeah, so either with your best bet is, well, Dr. Ernie for sure, probably not the best learning experience, but yes, that is, but you're following the MA, right, during the screening. Oralia is another option, and Dr. Yoshiyama does those as well. If you are at Circle, definitely Dr. Rivas would be doing pediatric visits, and then if you are at North Main, several options that, depending on who's there, Dr. Wright will do them, and I just, Dr. Cordier.
Dr. Cordier.
Thank you, Vanessa. Yes, Dr. Cordier is the pediatrician there. So yes, please, at least one, you know, from start to finish. So we are going to look at development. And let's do it this way. So we're looking at the concept. What are some risk factors for developmental delay? How do you know that somebody's met where they're supposed to be, recognize developmental delay, know what the milestones are, and then be able to provide interventions, nursing interventions, right? So same kind of things looking at the concept. So when you think of growth and development, there's physical growth, right? There's like, you can grow taller, bigger, you mature. There's psychosocial and how you interact with other people, how you interact with your environment, and cognitive development, how your brain changes, how you learn about things and experience things. And that happens across the lifespan. So it's not just during childhood, but those things occur throughout the lifespan. And so you're looking at, you know, the physical growth, there's differentiation of being able to do different things, and then also maturation. So in looking at development, again, not just children, but across all healthcare settings, population groups, ages, Development, we look at across the lifespan. When you look at, so growth, the definition of growth is physical growth, right? I'm getting taller, I'm gaining weight, my head circumference is increasing. That's the definition of growth. When we look at development, development are the things that you're able to do because of not a physical growth process, but those things we just talked about, cognitive, physical, and psychosocial. So development is organized. It progresses in a specific sequence across life stages. Even in twin studies, it just, you're gonna have the same sequence. Might be at different times, but same sequence. Because what do you hear? I think we even heard it at Clinica. Oh, my first child, walked when they were 10 months old. This child isn't even crawling yet, right? Yet, like, you're comparing, right? So it's not always, every child has their own time frame. How's that, right? Every child has their own time frame, but it should go in the same sequence. And the order of the development, right, more important than the chronological age. So the speed varies. And I just gave you an example. There you go. So the links, right, I posted these, I showed you these are just on the page, the theories and theorists, Freud, Erikson, Piaget, Kohlberg, and the contemporary theorists, those are the ones like Atchley and Peck. Havinghurst is a good one to look at, and those links are all there. And the focus for you guys would be to know Erikson and Piaget, what that looks like in terms of the stages, right? Erikson has stages, Piaget has stages. And so what are some risk factors for delay, right? Pediatric populations have the highest risk. Why would that be? Why do you think?
Nutrition.
Nutrition. Most of the growth happens. No, go ahead, Amy.
That's what I was going to say, is that most of the growth and development is happening in those, first 18 years.
And when also does it happen other than those 18 years?
Well, it happens throughout our lifetime, but there's a high intensity of growth and development during like pediatric time.
Yes,
right?
there is. But I'm asking what other time? Is there a lot of
like in the life of development?
I mean, and that's open. That's an open question to anybody, by the way. I don't want you to feel like I'm putting you on the spot, Amy. I'm trying to expand.
I don't have an answer. So
I guess if menopause, like for future in the women, like who like are older.
Go the other direction.
Oh, I guess puberty.
Utero.
Yes, in utero.
Mm.
Right? Who said in utero? Nice job. Is that Francisco?
Aaron.
Aaron, thank you. Sorry, I only see like 3 of you. I can't tell. Good job. Right? Because that's when the fastest growth and development, right? So we tend to think of it, once the baby's born, right? But there's a lot that goes on prior to that can affect growth and development once the baby's born. So just to be thinking in terms of that as well. So prenatal risk, right? Are they getting prenatal care? Are there any genetic things, toxins, right? Smoking, alcohol, drugs. We'll talk about that more in second semester when we talk about maternal child health, but how that affects the mother and the baby and the environment, right? And then what about when the baby's actually born, right? If they're premature, low birth weight, there can be developmental effects, birth trauma, if the baby is anoxic. So what's anoxia?
Not breathing.
Right, like no oxygen, not breathing, right? That term, right? Yes, in gas exchange, right? We just had that term, right? And see how this all comes together somehow, right? And so that can lead to cerebral palsy, some developmental delays, different things like that. So there's also delay as a result of birth, bad, ill health, nutrition. Somebody mentioned nutrition, cognitive impairments can all affect that development. And the family, right? Depending on the socioeconomics, where they live, how many people are in the family, if they're able to go to school, what the parents' education level was. Those are all factors for risks for developmental delay. And then situational risk. So any crises, a pandemic, right? We're seeing that, bullying, abuse, sexual abuse, interpersonal violence, violent family relationships, right? That can all affect development. And then our social determinants of health, right? Going back to the social determinants, right? The economic, toxins, living conditions, where you live. Is there a lot of disease in that area? Is the community kind of like disbanded? It's not a community actually. And I think one of the big things are these last two, right? Access to healthcare and access to proper nutrition and safety, right? Those are huge, right? That's kind of like Maslow. Remember we talked about Maslow? Having your basic needs met and then safety. Toxic stress, so child abuse, domestic violence, social isolation, chronic everyday stressors, like nursing school, or strict parenting. And then illness. There's a difference between an acute illness or a chronic illness, right? Or if there's severe injuries, or maybe there was prolonged hospitalization. Somebody was sharing, I can't remember if it was Vanessa, I forget, sorry. Somebody had, or Mai had, they had mono, right? And that's not a hospitalization, but if you have mono, you're stuck at home, which kind of like we are now. And so how does that affect development? And so how do you know that somebody is moving forward through the correct developmental process? So there's different types of assessments, right? And you can do assessments throughout the lifespan. The key, especially with children, is early identification, right? Assessment and early identification of problems so that you can do referrals to get help for the child and the family. So knowing risk factors. And if you're looking at risk factors, then knowing the developmental milestones, is this child kind of within where they need to be? And then regular screening. For example, the MChat for autism is one that they do around 3 years old. But we're checking on, I'm going to show you the different questionnaires that they have that are available to you. And we do hear, right? If you're doing the physical, you do hearing, right? The hearing and vision screening, right? I know some of you have seen that, yes?
Yes.
Yes, okay. And that screening, we catch it early, then we can provide interventions. Growth, motor skills, social skills, screening, right? And then you also can use the growth charts that are on the CDC, right? They're like the blue and pink pages and they have the little curve on them, and you look at where their weight and height based on their age is. And so you can be at the 50th percentile, and that's great. You can be above, you could be below. That could still be great. My son was a 32-week preemie. He was below the 5th percentile, I think until he was 4 or 5. But he had his own growth curve that matched. It just happened to be below the norm because he was premature. And screening is not a diagnosis. So for example, if you're using the MChat, which is a screening tool for autism, like I said, it doesn't mean that the child has autism. It's just a screening tool. And so these are different examples. I have the links on that page. Oh, I don't have a link to the Denver. I have to put a link to the Denver because we don't use that so much anymore. But basically a checklist of, does your child do this? Check. Do they do this? Check. Right? You're going down the checklist. I'm going to hold off on this a second because I want to get through to some practice questions. I think I have practice questions. And so when you're looking at adolescence, it's a little bit different. I need to put the link for the heads. I forgot to do that as well. So sorry. But you add things in, right? Now there's sexual development. I just heard I think it was yesterday on the radio that the incidence of suicide in adolescents right now during the pandemic has increased. I don't have the exact statistic, but that's what I heard. And that's, why do you think that would be?
They're isolated.
Yeah.
Yeah, less interaction.
Yeah.
They can't be around their friends at school.
That's huge for teens, right? The peer groups, right? That's their life. Forget about parents. They're stuck at home with the parents now, right? They can't be with their friends. And then risky behaviors, you know, they're, you know, having these feelings about other people and, you know, acting on those feelings. And so we're actually, I think week 9 is contraception. We'll review that there, but trying to identify that. Depression, postpartum depression is another one. There's a screening tool for that as well. So just know that there's lots of screening tools out there. And I'll add the links I missed. I apologize for that. And so when you're looking at adults and older adults, there's the geriatric screening tools. There's like dementia, there's screening, there's like the it's called the mini cognition test. And so assessment. And so you ask them, I don't know, I think it's cute, but you ask them to draw a clock, right? They have to actually draw a clock. You just say, draw a clock. And some of them can do it. Some draw the circle and they have all the numbers. And then you say, draw a clock, I think it's 11 o'clock, 12, no, not 12 o'clock, 10:10, something like, I can't remember there's a reason they choose the number they choose, but I think it's 10:10. And like the numbers sometimes are backwards, or they'll leave out numbers, or they'll do like 1, 2, 3, 4, 5, 6, 7, 8, 9, and then 10, 11, 12, right? And that is a clue to their cognitive function. And then there's also fall risk, which is more of a safety type thing, but it has to do with mobility and are they able to care for themselves? There's stress and coping tools. There's caregiver screening tools. There's a tool for everything. You can find it. And then, so what do we do with that information, right? So again, early identification is key to be able to have interventions. It'd be the same thing for dementia. What about kids only exposed to digital clocks? Yeah, I think we're going to be there in about 10 or 20, 30 years maybe, because right now it's mostly the elderly. It's not going to work, right, exactly, much longer. We'll have to come up with a new one for that one. I can post it's in the consult Jerry, but I can pull up the exact mini cog so you can see, because you have to list things in order. You know, they tell you to repeat words back, and then like 5 minutes later, you're supposed to be able to repeat the words back and things like that. So early identification, intervention, we figured that out. Then you have specific, right, depending on the delay, you know, physical therapy, speech therapy, occupational therapy, special ed in the classroom, different things like that. And then that requires interdisciplinary collaboration. So if taking the example of a child, say they have, what do they have? Down syndrome, maybe they have trisomy 21. And so they will have at school, they'll have an individualized education plan, right, which talks about what their specific goals are, but they're going to have, the school nurse is going to be involved. At some point, they may have needed physical or occupational therapy, and perhaps speech and language. Like all these things come together, and hopefully through the school system and the healthcare system, the needs are met. Hopefully, I say that. And then interrelated concepts to development, nutrition. We keep coming back to nutrition. I think nutrition is important. It's interrelated to everything. Culture. Cultures look at development differently. The roles of people in the family, family dynamics. And then the book gives you these specific medical type exemplars. We did mention autism. I'm actually doing a CE on attention deficit right now. But our focus is more on the early identification and screening, and then the interdisciplinary interventions is what we're looking at there. So for your That's a Wrap, and we'll go back to the development groups in a couple minutes. This is what you need to know, like Piaget-Erikson, the risk factors, be able to know just that there are different tools, different screening tools, and examples of those. Not necessarily what they ask, but like there's ages and stages, there's bright futures, those types of things. And then that early assessment and identification is what is key. So I was going to put you in breakout rooms to look at the case study. So if you go back to the lesson for the day, right under activities, it says case study. And so I'm gonna put you in breakout groups to talk about that a little bit. And then if you wanted to, let's do the case study first, and then I'll tell you about the templates if you want to do those. So there's the case study. It gives you some basic information. It's a 3-month-old coming to a clinic appointment. I gave you the developmental milestones, that list we just had, the growth charts. This is the bright futures visits. This is the ages and stages, so you can see the different questions that you would ask. It used to be like when nurses would do the Denver, we would sit there. I remember doing it on my nephew, and the nurse is looking at the child and kind of asking the mom the questions. The ages and stages and bright futures, now the focus is on the parent, right? We're really trying to bring the parent into the conversation, which I think is great. And the parent can actually fill some of these out ahead of time, or if they have questions, you know, there's on the questionnaire, they filled them out already so they can write down what their questions are, right? Don't you always tell you, write your questions down before you go to the doctor, right? And like, who does that? Some people do that, but this gives a tool of how they can do that. So does that make sense? You're going to go through the case study, and then what are some examples that would lead the nurse to conclude further evaluation is needed in terms of this particular case, but also in any 3 to 4 month old, what would lead you to conclude that there was further evaluation needed? And then looking at what developmental milestones would the nurse check for at the 7-month well baby visit to the clinic. Does that make sense? Yes, no, maybe? Anybody? All right, hearing no objection, I'm gonna put you in breakout groups, and we'll do bigger breakout groups. How's that? That will help.
Yes. Mm-hmm.
Okay. There we go. All righty. It's about 10 minutes, 8 minutes. And there you go. And I will check in.
Hold on one second. I'm in a breakout group.
Oh, okay. I'm just in the. I'm in.
And so you can click on the data table. See, it says that on the left hand side, data table for girls, like either one of those. And it was a. Oh, I know. What was it? It's a girl. Yeah. So what I would like you guys to do then, and see where it says recommendation to the right. To the right. There. Use the WHO growth charts or the CDC growth charts. So you want the WHO growth chart for children 0 to 2. This is part of evidence-based practice. This is part of using resources to find the information, right? So I think you have a good point. I think it was Isaac, like I have to look it up. Yeah. So this is you guys go look this up, right? And then take a look at the ASQ when you're done looking at that to see kind of what questions and stuff there are. The child's pretty much on track. Yes. Right? But the thing is, how do you know where the resources are to look, right? And find that information, and then to provide that information for the family as well. Yeah? It should. I don't know. Sorry about that. Or somebody else can find it and share it. That would work too. That'd be great. I need to go talk to Miss. I need to go talk. Yeah, that's weird. Oh, there they are, down there. There you go. Yep. Yep, girls. Hello.
Hey.
Sorry.
No.
Are you still there?
Yeah, I'm hanging out because I'm here. I'm in the.
Put
I'm
you on
in
speaker.
the.
Sorry. Or no.
No,
I
I'm hearing
didn't
you.
on you.
No. Look up. I'm here.
Oh, hold on. Oh, you're there.
I'm like, I'm here. I see you.
I'm sorry.
I'm like, you're on your phone. I'm like, no, I'm here. Look up. I'm here.
I'm sorry. What was that? Sorry.
No, it's okay.
Oh my goodness. I was going to go in another breakout group to see how they're going.
Okay. I just wanted to join, so I'm assuming you haven't gone over the test yet with them.
No, that's at 11:15. There's a separate Zoom in 46.
Oh, okay.
Yeah, no, you're good here. That's fine. Yeah, I'm trying to figure out a way. Like, there's certain students that keep participating more than others, and other students are feeling like they don't get a chance to think. So I got to think of a different way. Mostly in breakout groups, it was said. So I got to figure out how to.
It's the quieter ones, or what is it? The quieter ones?
It just takes a while for them to process stuff. Right?
Are they in different breakout groups?
They're not VNs. Well, yeah, they're just
like in their cohort. They're not cohorted, right?
No. So let me go on a couple more people and add
this is not where we're going to go to do the. Okay, so I'll go back and look. I just wanted to pop in. So
thank you. There's an announcement in 46 with the link.
For everybody.
Yep.
Okay, I'll see you later.
And then, oh,
Hey, sorry. It pulled you back. So the 2 groups that I was in, you guys were doing a good job. Use those resources. Were you able to plot those, Emily?
we were just trying to get that second one done when it popped us back in. He was just telling me to wait.
Yeah,
No,
the
that's
last
fine.
11.2 pounds was the current weight.
Okay, so that one was, you said 11.2 pounds?
Yeah.
She's still in the right growth.
Okay.
She's
Did
still around
anybody
that
else
like
get a
90th percentile.
90th percentile? Okay. Did anybody else get a chance to plot that on the growth curve? Probably not, maybe. But yeah, so does that help, Emily? And like Greg, your guys' group, like you got a chance to do that, right? So there's a nice visual for you of her growth, her individualized growth curve, which is great assessment data. Does that make sense, right? How to use those tools. So yeah, you can continue on with the case study, whatever you want to do. I would suggest for sure looking at the ASU and the Bright Futures, just to see what those questions are. Also, when you're at Clínica de Salud, they're in a binder. There's a reference binder for you, and they're all in there for you. And the other thing that you have available to you, again, we're not looking at necessarily specific milestones at this point, but there are growth and development templates. I know you know about the medication template, but there are worlds other than medication templates. Just wanted to let you know, right? You're probably tired of doing medication templates. But there are growth and development ones. I don't know, John, is John around? John, did you find these helpful?
Yeah, I did.
Yeah, so John was in growth and development. Armel, you or anybody else, were those, hi Armel, were helpful? Yeah.
Yes.
Yes. So if you want to do those or share them amongst yourselves or assign one or another, right, you can, then you have a then you have a template for infant, and then like toddler preschooler, which is early childhood, middle childhood, and adolescent. So those would be like study tools for you. But again, I'm not going to test you on anything specific other than Erikson or Piaget, like what stages a child might be in. That's the only, does that make sense? So that's more for you guys if you want to visualize or have a study guide by age group. And then feel free to, if you're going to look at something, go ahead and look at the at this link. These 3 are articles, but take a look at the ACEs. It's the National League for Nursing website, and it talks about, which you already did in Family Dynamics, but not this particular website, I don't think, but talks about risk factors and being safe and family dynamic kind of things along with development. So questions on anything? Probably not. Fridays always seem like, oh, it's the end of the week. Okay, so 11:15 exam review in 46. The link is in the announcements for 46. Okay, and then also the policy and procedure is posted there as well if you guys looked at that. So just so that everybody's clear. But then I will see whoever wants to be there at 11:15. And I'll hang out if people have questions.
I had a question about the developmental milestones.
Yeah.
So on that sheet that we were looking at, it has like 4 months for rolling over front to back. At what, so after 4 months, then it's considered a delay, or?
I mean, usually within.
At what point is it considered a delay? Yeah.
I mean, so every child is a little bit different, but, and if you think in terms of when the child is going to the pediatrician, the visits, right? Because it's usually 2 months, 4 months, 6 months, 9 months, 12 months, right? In that in that, right? So if the child came to the 4-month checkup and was not able to do that particular task, then you basically start backing it to the 2 or 3 month and see, okay, have we accomplished these? Have we accomplished these? Have they right? Like you back it up to see, because my guess would be, sure, the 2 month was good, and now we're at the 4 month and they're not doing 1 or 2 things, right? So we make sure that what they have accomplished, and then depending on what the task is, like I wouldn't necessarily be, like I'd want to see them at the 6-month checkup, of course. And if they were still having, if they hadn't completed that milestone, then I would be concerned at the next visit. I wouldn't be necessarily concerned right at that point in time, because we said everybody has their own time frame, kind of, right? But if they continue to not reach more milestones, then that also is a concern. So probably at the next checkup, where you run into problems would be, oh, well, I'm doing the 1-year checkup and I'm not going to see the child till they're 2 years old. There's a big gap there. So anytime, the other thing is anytime you think that there's going to be a large gap, or that the parent isn't going to bring the child back, like you're not going to see the child, then I would do a referral, just hopefully to get them looped into some kind of resources. What else? Yeah.
That's funny, Amy, because my 9-month-old daughter, she just started rolling over like 3 weeks ago, maybe, and then started crawling last week. So it was like, she just showed no interest in it at all.
Yep.
But everything else is fine. And then all of a sudden it's like go time.
Uh-huh. And sometimes that happens. Like, so I don't know if they were concerned or not. If the pediatrician was concerned or not, probably not.
No. Everything else was fine.
But you have to roll over and sit up before you can crawl. There's the sequence, right, that happens.
Yeah, so she did it, and then it was just like, it started taking off.
Boom. Exactly. Is that Peach Tranquility, Hugo? Sorry, just checking. Yes, Danya.
No, it was Amy. I just
was Amy, sorry.
clarifying.
I was looking at Danya. Amy, sorry.
Yeah. I know she's in the middle of the screen, her little pretty smile. So it doesn't necessarily, so one delay in a milestone isn't necessarily considered a delay. It's when there's like a kind of like a backlog of delays that it's concerning. And then I had another thought, but it went away. So I'm just clarifying about delays. And then, I mean, if there's one skill that isn't achieved after, because you said that's what it was. There's a normal range for individuals, right? Like there's a range for individuals, but at what point is that range no longer acceptable as normal?
Right. I don't know as there's a specific, it's not like you say, well, at 6 months or 3 months, now we have to refer. It's always sort of taken in people leave and then you move. Like, oh, there you are. Taken in context. So for example, Greg, if I can use your example, so rolling over, like that's a 4 month, 4, 5, 6 month is when I would expect that. But if everything else was being met and being interactive and, the nutrition is good and like you're looking at the whole picture, then the pediatrician wouldn't have been very concerned necessarily. And like Greg said, sometimes they wait on one and then once they get that one, boom, they go through like tons right after that. So it kind of depends. Now speech, that might be a different thing. Like I know with my granddaughter, she was starting to verbalize and she had everything good up to about 1 year old or maybe 13, 14 months. And then I kind of noticed a regression. Like she wasn't saying more things. She was actually saying less things. And so we actually, I just told my son, I said, I don't mean to butt in, but, ask that, can you check with the pediatrician? Because I happen to know the pediatrician also, and maybe get her evaluated because she was also having some behaviors that could be considered indicative of autism or being on the spectrum. And so that they went and had her evaluated, and they decided she wasn't on the spectrum, but they can't start some of that till they're a certain age either. So like 3 years old type of thing. But then she had pretty intensive speech therapy, and she's doing really well now. So that's good. So it's sort of it can be on an individualized basis, but that's why we do anticipatory guidance. That's why we try to teach the parents with the ASQ and the Bright Futures. These are the things that you should be looking for your child to be doing. And if you notice they're not, or say Greg was playing with the child or something and noticed that there was something that the child had been doing, but now isn't doing anymore, then, he would call the pediatrician and say, hey, I kind of noticed that, what do you think about this? Right? So it's educating the parents as well.
And sometimes we notice that the kind of kids are kind of skipping steps. Because for my little daughter, she was able to sit around 6-7 months, but she didn't crawl. So starting by 10 months and a half, we noticed she just start, grabbing the table to stand up without crawling. So
wow.
Yeah. So it's like, crawling, the difference between crawling and then walking was like 2 weeks or 3 weeks. She just like do it a little bit, and then she just start like making some steps. And
wow.
Yeah. So depend on the kid.
My middle son had a cleft palate, and he had surgery, and he actually took his first step in the hospital, and he was only 9 months old, 9.5, almost 10 months old. It's like, wow. So yeah, it's all kinds of different things. All right, anything else I can do for you guys? Otherwise, I want to go get ready for the exam review, but I'm happy to stay and answer if people have questions. Do you have a question, Marco? You're muted.
Oh, sorry about that. I do have a quick question, Mrs. So
Not SB, S,
not
just
SB,
S.
yeah, Mrs. S, yeah, Mrs. S. With the well child visit that we were talking about earlier, I'm just trying to figure out like what my options are going to be.
I have options for you.
Perfect. Awesome. Thank you.
You're very welcome. Not a problem.
Yeah, I was just like, wait a minute, I forgot to ask a question. Let me see if I can.
Yep. Sure. Nope, it's all good.
All right. And then another question was, I was a little